What effect does swimming have on high blood pressure? Studies show that swimming at a very light intensity has a positive effect on high blood pressure. Gently swimming 4 to 5 times a week for 30 minutes or 3 times a week for 20 minutes is appropriate for people with high blood pressure. Initially, you should swim short sections with long breaks, and shorten breaks and extend your swimming stocks over time. Low blood pressure. A large number of people, especially young people, have low blood pressure problems. Low blood pressure is more harmless than high, but it creates a lot of discomfort. A regular light swim will tighten your blood vessels, and deep breathing will supply all the cells with extra oxygen. Improving circulation and massage through water resistance also eliminates the discomforts caused by low blood pressure. Asthma. A large number of people with asthma experience seizures during exercise-induced asthma. The characteristics of these attacks depend on the intensity of exercise, the need for air, and the environmental conditions. This is why swimming is the best choice. Breathing technique in water strengthens the muscles that allow the exhalation to take place, which is problematic for patients. Swimming with a chest technique or a crawl is recommended. Back pain. Everyday sedentary lifestyle causes numerous spinal problems. Some of the problems are based only on poor posture, and sometimes these are defined deformities in the spine: lordosis, kyphosis, scoliosis. Today, almost 90% of the population has back pain in acute or chronic form. For spinal health, back swimming is recommended until the chest or butterfly is recommended because of the large movements in certain parts of the spine as well as the position of the head and cervical spine when swimming in the breast. Exercises should be conducted in slightly warmer water, 27 to 30 degrees Celsius, to adversely affect the existing condition. Injuries to the bone system and postoperative treatments. Water is a therapeutic agent for bone and joint injuries. After surgery on the bones and joints, there are limited activities that can be performed, and water is the most appropriate exercise medium due to apparent weight loss in the water. This applies to different types of activities in the water: exercising in a place, walking in water, exercising in deeper water. For knee injuries, it is ideal to do leg movements in the crawl and back technique, and the load can be increased by swimming with fins. It is preferable to use shorter fins. The load should be dosed to the limit of pain. Why is swimming recommended for seniors? Recreational swimming is also recommended for the elderly because exercise in old age often has specific limitations, and swimming does not have any special contraindications and can swim up to a deep age. When swimming, the heart muscle becomes stronger, and because of the strengthening of the muscles, the breathing is deepened, so the body cells receive more oxygen, which is extremely important in older life. In addition, swimming does not burden the joints that can be damaged in old age, e.g. arthritic changes, spondylosis of the spine. Swimming stimulates mood and reduces depression and anxiety that are common in older life. Swimming an ideal physical activity for obese people. For people with a body mass index greater than 25 or 30, swimming is an ideal choice for weight loss. Most other activities will put a lot of strain on your joints. When swimming, the body apparently loses weight and the load is reduced significantly. Due to the density and resistance of water, a large amount of energy is burned. In addition, obese people have no problem maintaining it on the water because the fatty tissue is more fluid than the bone and muscle tissue. For weight loss, it is recommended that you take a gentle swim with a chest technique for 20 to 45 minutes, a minimum of 3 times a week, or a freestyle swim of similar duration and frequency. After mastering this step, it is recommended to swim in a crawl or back style.